before we start applying the spray, before we start actually treating any wound or putting a dressing on any wound, the first thing we have to do is to clean the wound. I think that is very important. Debridement of the wound is most important because we have to get the slough out from the wound, and that is what we do. And after that, it's smooth sailing. It's just spraying this twice a day. That's all, and covering it. Sometimes I cover, sometimes I don't cover. It depends on how big the wound is, whether it's a weeping wound or dry wound. If it is a weeping wound or big lesion, then I just spray it and then cover it with a very light gauze, just to cover so that it won't get scratched or anything like that. And then as we go along, when it becomes dry, I would prefer to leave that wound open and spray it twice a day. That's all you need to. Twice a day, and you can see results. Now many may ask why I leave the wound open, instead of closing the wound, which is a conservative method. You see, if the wound is dry, I would prefer to actually leave it open. If it again depends on where the wound is situated. If the wound is situated at a place where there's a lot of friction with the bed or the chair, then I will keep it dry. But if it is not, then I will leave it open because there's no oozing. It is very dry, easy to do dressing. It's just spray twice a day and you can actually see it healing. The other thing is, I also feel that exposing it outside to atmospheric air, the healing seemed to be faster. And that is why I think I would like to promote this kind of management. I'd like to actually bring out one case, which is, I find it very amazing for me because this case actually came to see me because somebody told that we are doing wound care here. And that was the initial time when I received this spray, so I was very excited because this person, and this ulcer was a very chronic ulcer, which she has been having it for the last 6 years, and she has been going all around trying to, treat this ulcer. And it is a venous ulcer, actually caused by varicose problem she had. And so she came, there were 2 big ulcers, and then I explained to them that I'm going to try this, this is a new way of doing dressing. We will see. I actually told her I cannot promise you, but because you have seen so many doctors, 6 years, I'm sure they would have tried everything. Let me give a shot. So I said every 2 weeks I wanted to see you. So they came from quite far. So they were coming after 2 weeks. As we went along, say about 2 months to 3 months, I could see the wound, the ulcer, actually getting smaller, and I was very impressed by it. Both the ulcers were getting smaller for the first time, and the patients were really very excited. And so we continued for some time. It took us some time, at least about 6 months or so, and it became quite small. So I told them, okay, now it is getting better. So what you do is, I'll give you the spray, just continue, because they were coming from quite far, from another town, So it was very difficult for them to come. And I gave them the spray and they continued. If any problem, I told them to call me. If it is okay, then it's okay. So that was one case which I talk about because there was really a good case where everything else failed, but this saved them.
Okay.
The fastest wound which healed in my practice was actually an operative wound. Actually, she had went through an orthopedic operation, and left a wound, which was not healing for a while. And then she came and saw me, and then she was actually a foreigner who was going back to homeland, and then she wanted to get healed within 2 weeks. So she said, I don't mind even coming every day and all that. So I started her on that. Before she left, before 2 weeks, the wound actually healed. And there was one very fast healing within 2 weeks. Okay, something I would like to mention about diabetic wound, which is very commonly treated in our clinic. Diabetic wounds are the most common chronic wounds which we see, and we all know that if it's untreated, it can cause a lot of problems. It can go up to amputation, etc. So in order to stop this, we have to be very, very concerned about this diabetic wound and go all out to treat them. We have tried many ways in the past. We have used many materials in the past. But of late, with the introduction of this Dr. Noor Spray, I found a lot of improvement in this field. I've at the moment actually doing most of my treatment on diabetic wounds using this spray, and I find a lot of improvement. And I feel that I think in my practice, the number one line I'm using now for diabetic wound is Dr. Noor's spray.
Okay.
Now we come to the last part of it, that is the cost, which I'm sure most of you want to know. Conventional treatment in the past was not very costly, but of late, materials for treatment for wound dressing has become very, very costly for people, for ordinary patients to afford. Now, with the introduction of Dr. Noor Spray, we have found a lot of help in this field, that is, to save costs. Now, one thing is, we don't use or we don't ask patients to come every day for treatment, or once in 2 days, or once in a week, or once in whatever time to come back and come back and come back, which incurs a lot of money. Here we give them the spray, and then we ask them to use the spray for 2 weeks, 3 weeks, and even 1 month. And they use the spray until the spray is over, and then we sort of follow them up. In the meantime, what we actually do is we call them maybe 2 weeks once to find out how the response is. So if you want to save money on this, then you see them less, but follow them up through phone calls or through WhatsApp or social media. So in this way, you save a lot of money.